If you've ever seen research on therapy animals, you know the good work they can do, visiting sick patients, and they really help make the healing a lot easier, especially with our kids. So that's why Nemours Children's Health offers animal therapy locally. So as we recognize National Animal Therapy Day on Sunday this weekend, we want to talk more about this. So pediatric psychologist Dr. Schilling joins us. Also, ADAPT clinical director Jenny Pfieffer joins us as well. And we cannot forget Asher, our beautiful horse-like professional therapy dog, which funny, Jenny, you said he actually was the runt of the litter.
Yes, he was.
Oh my gosh, but not anymore. You're big and you're beautiful. So tell me a little bit about Asher and what he is able to sense and what he's able to do.
Sure. So this is Asher. He is one of our professional therapy dogs at Nemours, and ADAPT actually kind of got the vision because of how much I love our therapy animals. I have Gypsy, the mini horse, and this is Asher, the Great Dane, and I've actually been a pediatric nurse for 20 years at Nemours. Okay. And just kind of gave me the vision to kind of start something like this.
Well, it's awesome to be supported in that way as well. Talk a little bit about these animals and how they can help. I know I've seen, dogs that can sit with kids as they're learning to read. There's just so many benefits with animals.
There are many, and our program is a partnership between a licensed clinical health care provider and a therapy animal. So in our case, it's a psychologist or a social worker with a miniature horse or a dog.
Okay.
And I specialize in working with children with cancer. So my therapy horse is Taco, and my dog, my personal dog, Teddy, is my therapy dog.
All right,
so
we have some photos if we can get them of these two. All right, go ahead.
Okay, sure. So a good example of what that's Teddy.
Okay.
A good example of what animal therapy might be would be an obstacle course. So for example, we will set up an obstacle course and the patient will lead Taco through the course.
Okay.
And we'll look at maybe what some of the challenges are for Taco in getting through the horse, but then also talk about what the obstacles are that patient has had to overcome.
So it bridges that gap and allows for that communication.
Exactly.
What is it like when you're working with a young person and then the animal comes in? Is there just like an awakening and an opening of them?
There is, and I'll say Teddy is especially good for kids with social anxiety. So our patients who have trouble talking, even to me sometimes, or who have difficulty with social interactions and kind of look sad when they see him in the waiting room. They just light up.
It's completely different, yeah.
It's very easy to talk when there's a dog walking around. It's much easier.
I always say babies and animals. Those are the things that bring us all joy. All right, so what's the process for clinicians and their animal partners to get registered to be a part of this program?
Absolutely, great question. So all of us on the ADAPT team, we actually went to University of North Florida. They have a program that basically taught us how to ethically partner with our therapy animals and how to incorporate them into our healthcare setting. It was a postgraduate certificate that we did. That's the people part. Okay. And then the animal part, as far as the canines and equines, they are registered animals with pet partners, which basically sets the standards and evaluations and training every 2 years they have to go through.
All right, well, good for you for having the instinct to do it and to follow through with it and get all the training to make it happen. And it's wonderful to hear all the benefits. Good job, Asher. Good job.
We're
bringing a lot of joy.
Super excited because as far as we know, and it's been proven, we are the first in the country to have a program like this. Okay. We actually have several barns and fences right behind our Jacksonville campus, Nemours. And we, it's makes it very much more unique.
Okay.
Asher's like, I'm done. So we're just really excited to be able to bring that to our patients and families and to be the only one in the country to do so. Congrats. And research starts in the fall.
All right, there we go. All right, Asher, good job. You're clear.